Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How is Kyprolis Carfilzomib administered? Kyprolis Carfilzomib for injection is given as an intravenous, infusion, which involves delivering the medication directly into a vein via a needle. A Kyprolis infusion is usually administered in a clinic, hospital or doctor's office. Kyprolis is used to treat relapsed or refractory multiple myeloma and may be given on its own or in combination with other medicines including Dexamethasone Daratumumab, Darzalex, Daratumumab and hyaluronidasefihj, Darzalex Faspro Lenalidomide Revlimid, or Isatuximab SarclisaHow. How long does it take to receive a Kyprolis infusion? The time it takes to infuse Kyprolis varies from 10 to 30 minutes, depending on the dose of Kyprolis, the combination of medicines required and whether it is given once a week or twice a week. How many Kyprolis infusion per week will I have? Kyprolis is given once or twice a week depending on dose and medication combinations. How long is a treatment cycle for Kyprolis? A standard Kyprolis treatment cycle involves receiving infusions once or twice a week for 3 weeks, then a week without treatment. This is one 28-day cycle. The treatment cycle can be repeated until disease progression or unacceptable toxicity. Kyprolis Regime, Dose and Infusion Time. Regimen. Dosage. Infusion Time. Kyprolis and Dexamethasone Kd, or Kyprolis, Daratumumab and Dexamethasone DKd, or Kyprolis, Daratumumab and hyaluronidasefihj and Dexamethasone DKd. 20/70ths of a milligram/m2 once weekly. 30 minutes. Kyprolis and Dexamethasone Kd, or Kyprolis, Daratumumab and Dexamethasone DKd, or Kyprolis, Daratumumab and hyaluronidasefihj and Dexamethasone DKd, or Kyprolis, Isatuximab and Dexamethasone IsaKd, or Kyprolis Monotherapy. 20/56ths of a milligram/m2 twice weekly. 30 minutes. Kyprolis, Lenalidomide and Dexamethasone Kd, or Kyprolis Monotherapy. 20/27ths of a milligram/m2 twice weekly. 10 minutes. Related questions: Is Kyprolis a chemo drug and how does it work? Is Velcade a type of chemotherapy? Can Darzalex cure multiple myeloma? What precautions need to be taken when Kyprolis is being administered? Standard administration precautions include ensuring the patient is adequately hydrated, especially before the first dose of Kyprolis is given and also in patients at high risk of tumor lysis syndrome, TLS, or kidney toxicity. Monitoring of serum potassium levels, which should be done regularly during treatment. Pre-treatment with dexamethasone to reduce the incidence of and severity of infusion-related adverse reactions. Administering medication to prevent blood clots in patients receiving Kyprolis and dexamethasone or with lenalidomide plus dexamethasone. Administering antiviral medications to prevent herpes reactivation in those patients at risk. Administering Kyprolis after hemodialysis in those patients who receive it. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.